patient has to open his fist and has to observe for the color appearance.
See the palm. It is a pale color. There is no blood coagulation in the palm. Then
the clinician has to relieve the ulnar
radial or ulnar artery
and has to check for the blood flow through the fingers.
See here is the discoloration within a 3 seconds. Then ulnar. See here.
This indicates that the iron test is negative because there is proper blood flow in the patient's hand. If the patient's hand is remaining pale for up to 15 seconds or more than that, then it indicates iron test positive and it resembles that there is some occlusion or obstruction in the radial artery.
Modified Allen's test assess if the ulnar artery provide an enough collateral blood flow to the hand. If it is radial artery is compressed, so preventing the ischemia, which is a lack of blood. So it is a purpose to safety screen patients for before the procedures like arterial blood gas and radial artery cannulations or radial artery harvesting for bypass surgery to ensure the hand maintain an adequate blood supply even if it is on major. Allen's test to assess the hand circulation before the before the radial artery procedures, and while generally for adult it can be adapted for pediatric also. Simplify instructions asking them to squeeze a toy or to check we have to check it if ulnar artery provide enough blood flow. So ensuring that is color return to within 6 to 10 seconds after releasing the pressure, which is indicating the adequate collateral circulation, but it require a gentle handling and cooperations. So often needing a parent help also. So initial step to have a child, make it a tight first and apply firm pressure of both radial and ulnar arteries, and the rest to be stop blood flow causing a hand to blanch. So here after releasing, while keeping a radial artery pressed, the release of pressure ulnar artery, watch the palm, it should be quickly flush back to the normal color within 5 to 10 seconds. So if it is correct and there is a normal color of palm which indicate Allen's test is negative. See, it is negative. There is no more pale color or any discoloration of half and half side. So there is negative Allen's test, and the compression also should be in gentle manner. The baby's hand never handle it is in a hard. See, there is a compression. In a patient with normal arteries, and color should be returned to the palm relatively quickly within 5 to 15 seconds after release of either artery, ulnar or radial, which is indicating positive test. See, there is a dark color in the right side which is indicating positive test. And if it does not rub a hand, if does not return blood supply within 15 seconds, both the hand or any both the artery releasing or any one artery releasing, which is considered as negative, so suggesting inadequate circulation. The incidence is the radial artery is compressed and the palmar persists. This indicate a compressed and blood flow in the ulnar artery circulation. And conversely, if ulnar artery is compressed, the palmar artery palmar artery blood flow in the radial artery circulation get mixed. So it should be improve overall the accuracy of assessment. And if need to check digital plethysmography or ultrasonography with dynamic testing, and also using pulse oximetry, which is typically a sensor placed to the thumb and which is easily utilized and used accurately. Allen's test is simplified method, but there is a technique involving placing a pulse oximetry compression to obtain a baseline saturation and the waveform readings. So it is easy to understand the blood flow saturation through the waveform, and it is record. And although there is no specific complications at all, but it is negative, we have to check